Welcome, everybody. We are on week 10. We are going to do a HESI review tonight, and we have a quiz for first part of the class. So we will start with our quiz. Should be downloaded for you guys, and so you guys should be able to access it. Everybody able to access it? Yeah, okay. I do want to discuss exam 3. If you scored a 70 or below, I'm sorry, a 74 or below, please schedule a time to meet with me to go over the exam. If you want to go over the exam, we can go over it too. For our HESI review, we're going to go over major topics, and you guys are going to help us come up with some ideas of what to study. Everybody has a HESI guide. It's about 50 pages. So it's pretty extensive, but it had everything on there that we could imagine, right? So we're going to take our quiz first thing, and then we will do HESI review. Attendance is required tonight, and attendance is required for the rest of class. And then next week, your HESI exam will count as your attendance. And then week 12, please schedule a time to meet with me. That will be scored as your attendance. Okay. So I expect a email from everybody telling me when you want to meet during week 12. We can do it during class time if you want, or we can do it whenever you feel like. Okay. And that'll just be a review of the class and what you thought of it, and make sure that you have your surveys done and all that good stuff. Okay. So week 12 is required attendance. You do need to schedule an appointment with me. Okay. Any questions about that? All right, so we made it, we made it, we made it. Here's our last quiz of community, and I will give you your passcode. It's 402 or 602, so we're gonna do 15 minutes for the quiz. So we'll come back at about what's that? 4:18-ish. Okay, so around 4:18, 4:19. Okay, ready? You guys ready for the passcode? Passcode is with a capital C, community 24.
Are you gonna put it on the chat?
Sure.
Okay.
I missed the password. What did you say it was?
No worry, community 24, it's in the chat, okay? Guys, just remember to unblur your background. There's a couple of us that have a blurred background, so I need it unblurred. Sorry to bother you guys, but we still have 2 that have a blurred background. Please unblur your background.
It's gonna be the quiz number 5, right?
If you have a question, please send it in the chat as to not disturb. I'm gonna ask everybody to check the chat. I sent you a message if your background is blurred. Thank you.
Yeah, it's not working.
Hmm?
You got what?
Hey, we have one student whose grade has not populated. Everyone should be done at this point because it has been 15 minutes. So if you didn't submit your quiz, you're gonna get a 0. So I don't know who that was or why it's not submitted, but. Alrighty, so it's been 15 minutes of our quiz, so we're gonna start reviewing for our HESI right now. Are there any questions before we start? All right, I'm gonna share with you the schedule for HESI.
I have a
Based-
question.
Uh-huh.
Are we taking the HESI on like just on Zoom, or do we have to get it proctored at school?
No, you should, it should, I mean, it depends on your dean, how they're doing it, but it should be, over Zoom or whatever.
Okay.
What campus are you, Colby?
The Salt Lake City.
Anybody in Salt Lake City know?
We're doing it on
We oftentimes
campus.
proctor it, so I think it's on Zoom, but go ahead, Corey.
I was gonna say it's on campus. They have it scheduled
Where
according to my understanding for the other
where did
classes
you
as well.
see that? I saw that like some of the or the maternal classes
All
were.
right, I'm gonna share a schedule right now with you, okay?
Okay.
So everybody look at this Word document that I'm gonna share. It has all the campuses and all the times on it. Okay, so let's share that first. Any other questions about it? It should be, you guys should have it ready to go through your campus. Sometimes Salt Lake City is proctored by us, but it sounds like not this time. So sometimes the faculty has to proctor Salt Lake City. Okay, let's see. All right, here's our HESI time. So we have Centerville, Cincinnati, Columbus, Salt Lake City, since that's the one in question we'll look at. We have one Wednesday at 1 p.m. or Friday at 10 a.m. Okay.
Mental health is the one on Wednesday at 1 p.m. and then the community one is on Friday.
Okay, thanks for the clarity. This is the schedule I got. So these all look like they're community, but you know, I don't schedule, so. All right, any questions on your scheduling, your time, your place, what you're doing? No. All right, HESI is gonna be HESI like HESI's always been, right? So you guys have taken them before, you know, it's gonna be much of the next gen situation. Okay, so next gen kind of questions are, I have a patient who has blah, 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 blah. This is my nursing notes, these are my vital signs, and then they'll ask you a question. Our HESI is very med surge driven, so please know that. Okay, we're gonna look at some major topics that come off of the last HESI that we had. And we're gonna just review with each other what kind of topics you think might they ask on this. So let's take a look at my Excel spreadsheet here that I have, and this is right off of our HESI, okay? So we look at safe and effective environment. What do you think about that? What kind of questions are gonna ask you about a safe and effective environment?
Maybe a home health nurse.
Good, home health, what else? Think about a safe and effective environment as a nurse. What did we talk about in this class?
Having safe playgrounds, making sure that there's like crosswalks, the little bumps, things like that.
Good. Remember our environment chapter that we spent a week on? That was about air pollution. What else? What other kinds of things? Air, water, food, right? Remember all that? So that's where we're looking at some of those chapters. Management of care, what chapter do you think that is? Who helps the patient manage their care?
That be nurse care managing.
Mm-hmm. Yep, case management. What do we know about case managers?
Help
They
patients with
advocate for the
resources.
patient. They advocate for the patient. What else, Corey? You were saying something.
They help the patient with resources through each step of care.
It's always important. One of your questions on your test was about what is a priority for a case manager when someone's being discharged? What was that? Do you guys remember?
Was it the good negotiation?
No, it was something
No.
about
Provide
oxygen.
resources.
Remember, you got to make sure they have oxygen in the home before they go home. We always think about our airways, our breathing, and our circulation. I learned it as ABCs. What do you guys learn it as? Same? See, some things never change. So always think when you're reviewing a question, is there anything in there about their airway? Like, are they asthmatic? Do they need oxygen? Are they compromised in some way? Breathing, same kind of thing. Do they need a CPAP machine? What other kinds of things with breathing? Do they have their asthma meds? Do they have a nebulizer, right? All that kind of stuff. And then we see circulation. So they have their blood pressure meds. Do they have their everything to help with their circulation, right? Are they getting up? Are they moving? All that kind of stuff. I had a personal experience with this just this past week, and I'll tell it to you because you guys will remember this. I have a dad who's 79 years old, and he wasn't moving a whole bunch, and then he fell. And why did he fall? Not because he's not stable, because he had a medical procedure, and he's 79 years old and lives alone. And he was afraid that if he got up and moved around, something would happen. So what ended up happening is he had muscle weakness in his legs from not moving. And he didn't move for about 3 days. But 3 days on a 79-year-old man is a lot. So his legs actually gave out on him when he went to get up and he fell. Thank goodness, knock on wood, he didn't break anything, but it's been real chaotic in my extended family because of this. So think of this when you're reading these kind of things. Think about your own people in your lives and how was this impactful? My dad was a perfect case study for our class. That's what I told him. I said, Dad, great. Now we got a case study for my community class. So just think about the people you know. Think the older they get, the less likely they are to get up and move around. The less likely they are to remember their culture, those baby boomers. What do they look on their phones? How do they like to learn?
They like more formal, so like simulations, paper stuff.
Good. They like those handouts. So when he was discharged from the hospital, you know what he said? Do I have the paper? Do I have the paper? I said, yeah, Dad, you got the paper. Thinking, what's the paper going to say, right? You guys know what discharge paperwork looks like. So think about that when you're doing that, okay? And so they really want that paper. They're going to listen to that doctor. If that doctor says something, they say, oh, he's the doctor. He knows, right? So we as nurses are going to be really strong advocates for our elderly population, okay? We're going to question. We're going to say, hey, why are we doing this? What's going on? Okay. This takes us to health promotion and maintenance. This is across the board. We've talked about all different ages, right? What are we going to do with our kids to help with health promotion and maintenance? And this is Healthy People 2030. I'm not looking for anything specific here. Just throw out some ideas. What are we going to do for our kids to promote their health?
Immunizations.
Good. Immunization is always a primary. What else?
And safety.
Safety. What kind of safety?
Helmets, knee pads.
Good. Helmets, knee pads, if they're riding their bike, make sure they got a helmet on. What else do we teach to those younger kids so that they don't get involved in it as teenagers?
Like self-esteem for like violence or like about bullying.
Good. Bullying, for sure. What else do we see teenagers doing? They used to do.
Substance.
Yeah, go ahead.
I was gonna say vaping,
Yeah.
smoking, alcohol.
Yeah. It used to be smoking was really popular. Now vaping is the latest and greatest among the teenagers. So be careful because what do we know about vapes?
The oil is poisonous.
Yep, oil is poisonous to babies, to children. We also know that it does not necessarily have a smell. So back in the day, you could always tell when somebody was smoking because you smelled it. And now the vapes, they don't really all have smells or they smell like perfume. So it's a whole other thing. So you got to be really aware and alert. What are we going to do for our middle-aged people? What are we going to teach them about to help promote and maintenance?
Screenings.
Yep, go ahead with that. Screening's what?
Like breast exams, colonoscopies, um, going in and getting checked when you notice something's wrong.
Good. Remember, for our males, we're gonna have those, um, their prostates checked. We're gonna have their testicles checked, just like we do for women, we do for men, right? We got to keep it even across the board, although I think women have it harder, but that's just my opinion. All right, what else are we gonna look at here? Fluid and electrolytes. I'm gonna skip over a little bit because psychosocial and psychological, we've spent a lot of time about how to be therapeutic and communication, things like that. So you may see some stuff with that. We have fluids and electrolytes, important. What are some of those things that we see with electrolytes? What are some of those? Hyponatremia, what else?
Hypokalemia.
Good.
Hypomagnesemia.
Good.
Albumin.
All these electrolytes you guys know from med-surg, right? So think about what is that doing to our body? Metabolism, what do we think about metabolism? This is one of our topics that shows up over and over again. There's many diets, right? We teach our young kids about obesity. We try to do healthy snacks across the board, right? We're gonna talk to our diabetics about glucose regulation, right? We have different things we can do, blood sugars, we can teach them low carb, they don't teach low sugar anymore. They really teach low carb to our diabetics because it's a lot of carb counting now. So that's our glucose regulation. Intracranial regulation also is the ability of the inside of the brain to regulate itself. So you have to be pretty sick to have this off, but what kinds of things are we going to see if our intracranial regulation is off? Kind of neuro symptoms might we see?
Headaches.
Say that again.
Headaches.
Nah, yeah, that's a really mild one. You're probably not going to see that when your fluids are off in your head, but it could be a starting factor. What else?
Projectile vomiting with no nausea.
Yeah, vomiting for no reason because everything's off balance, right? What else?
Fixed dilated pupils, which is an emergency.
Right? How about
Neck
alert and oriented? Probably not so much. What
Neck
else?
stiffness.
Say that again.
Neck stiffness.
Stiffness. Sorry. Yeah, good. All those things that we're going to see are neuro checks. We're going to see on that regulation when it's off. Thermoregulation is going to be what? What's the word thermo mean?
Body temperature.
Good. So we can be too cold or too hot, right? We worry more so when we're too cold. There's usually something's going on major there. We have a couple questions on sexuality and reproduction. Know our STDs, know our signs and symptoms, know that, what else? We're going to teach to our adolescents about safe practices, right? We look at tissue integrity. What kind of things will we see with tissue integrity?
Pressure ulcers.
Say that again. Whoever keeps talking, I can't hear.
Pressure ulcers.
Oh, pressure ulcers. Very good. Not only pressure ulcers, what else are we going to start to see on some older people? May not be pressure ulcers, but we're going to start to see what?
Edema.
Good.
Brown
Edema.
spots.
Skin tears.
Yep. Tears. Good. We're going to start to see that skin. Remember, in our older people, the skin is really thin. So a simple cut, if they're compromised, right, isn't going to heal so great. So we always want to check for tissue integrity. And then once you have a pressure ulcer, then we all know we have to grade it and help them out, right? Infection and immunity. We talked about vaccines. Mobility. What kind of questions are we going to have about mobility?
Making sure they know how to use like their walker or making sure their environment's safe, like getting rid of throw rugs or things that they could fall on.
Good, be careful, we're not a physical therapist, so we're not gonna check if they're using the walker right, because we don't really know. Right, I mean, we may know, but we're not licensed to do that, right? So we're gonna be licensed to make sure they have a walker, make sure they have a cane. We're gonna leave that up to the physical therapist. That was a question on your quiz tonight, wasn't it? Something about physical therapy? It was, I think. Let me look and see what that was. Oh, I can't share with you guys. Oopsie. Let's go back to where we were. I'm gonna stop sharing for a second. There was a question about, let me just look real quick, because I remember typing it up. Okay, so we're gonna think about what other kinds of things with mobility. I just told you my little personal story to help you guys remember. What are we gonna remember when we're talking about mobility?
Becomes more difficult as they get older, their
Yep.
population.
Yep. And we want to be really careful, the longer they sit, what is going to be impacted?
Their blood pressure.
Absolutely, blood pressure, good. What else?
Full skeletal system.
Yep. And then we just talked about skin integrity. Remember, the less mobile you are, the less you're going to have that, blood flow flowing nicely, getting where it needs to go. I'm just looking for that question on physical therapy. Hold on. I think it was question. Right. Okay, well, forget me. I saw one on physical. I thought I wrote one on physical therapy. Okay, let's go back to our list here and see where we are. Okay. All right, so we talked about nutrition. We talked about all this stuff. Where are we down here? Mobility, comfort, pain. What do we know about pain? What kind of questions are we gonna have on pain? Do we assess every patient for pain? Even if they're not in there for something for pain, right? The minute you go into a room, you always say, what's your pain level today? Right? 0 to 10 is what we often do. We have those smiley faces for people that are not English first language. We have pictures. We have all kinds of things to assess for pain. Stress and coping. This will go back to those questions that you guys saw in an exam and you about family crisis. Remember, it's when they can't function, they can't go on, they can't move on. That's going to be our stress and coping, caregiving, grief and loss. We did a chapter on hospice. That's where you're going to see that pop up. Mood and affect and behaviors. Remember, we talked about different ways to learn, right? And effective learning is with feelings. So think about that. We have interpersonal violence. What kind of violence did we talk about in class?
Like
Sexual violence, partner violence,
Partner violence. What else?
elder abuse, child
Elder
abuse.
abuse, child abuse, all those kinds of things. So you'll see this kind of questioning on your exam as well. Okay, family dynamics, we talked about those families that spend some time together, right? What makes them more therapeutic, that they're not apart, that they spend some time together, they get to know one another. Health, wellness, and illness, we're going to see that with Healthy People 2030. We have some other professional behaviors, professionalism. That's going to be our ethics chapter. Remember our 4 main points. What were they? Does anybody remember? Beneficence. I won't give you the rest. You're going to help me.
feminism.
What else?
Autonomy.
Feminist ethics.
Say that a little louder. Sorry, I can't hear.
Feminist ethics.
Yeah, feminist ethics. We also talked about justice, right? Making sure everybody's treated fairly. Okay. Communication, like I said, I'm not going to do too much with that. Clinical judgment and clinical decision, critical thinking. I want us to think about our nursing process here. What are we going to do with our nursing process? Remind us what that nursing process looks like.
Assess. We're gonna plan an outcome, monitor, evaluate.
Good, and once you evaluate, what are you gonna do after you evaluate?
Outcome identification.
Yep, and you're gonna change it if it didn't work, right? Remember add pie? That's a good way to remember a nursing process. Let's see, what else here? We talked a little bit about management care. Let's look down here a little bit. We may see some about healthcare organizations. So remember we talked about Medicaid and Medicare, right? And what the difference is there. That's some healthcare organization and economics. Some policies, remember our goal as a nurse is to help our people be autonomous, right? And make sure they have their own independence to the best of their ability. We talked a bunch about informed consent, didn't we? And how that plays in with our nursing ethics. Evidence-based practice, a great topic. We talked about a ton in this class. What can you guys tell me about evidence-based practice? What's
Barrier
its point?
nurses not wanting to change their old ways, and it's supposed to be the best possible way and best outcome for the patient.
Good. And so we're trying to improve our quality with this, right? Improve quality improvement like we saw on our quiz and we saw on our test, right? So our quality improvement, and we're going to make sure we know what we're trying to get to. We know the people's jobs so we can improve each piece of that job. Information and technology, just know we have a lot of computer systems out there. It's a big part of healthcare right now. Our epidemiological triad. What do we remember about that? We have 3 parts. You guys wrote a discussion board on this one.
Agent,
Host and
environment.
Good. Agent, what else?
Host
Good.
and environment.
Beautiful. It's a triangle, remember? All 3 pieces meet together. So if we break that triangle, then we can break that that agent that's causing a problem. Cardiovascular system, we look at blood pressure screenings. It's going to be our primary prevention as we see for healthy people. Endocrine system, we're going to look at outcome evaluation. What are some outcomes we're going to look for if if we're talking about the endocrine system? What do we think of when we think of the endocrine system?
Diabetes,
Good.
thyroid,
Good. Thyroid, diabetes. What are we going to do for our thyroid patients?
screen and monitor their TSH levels, their thyroid levels.
Good. They're T3, they're T4, right? We're going to monitor all that stuff. When we do that, we're going to make sure that they're within normal limits. We're going to teach to our diabetics. We talked a little bit about STDs, right? TB screening. What can you guys tell me about TB screenings?
There's a few different ways to do them. You can do a skin test and it's positive if it's 10 millimeters in duration or larger, unless I know it's 5 millimeters. There's like an exposure of some kind. And then or you can do a chest x-ray to see if there's active tuberculosis, or there is a test called a quantiferin gold that is a blood test.
Good. And for our TB screenings, you're going to see most of the time it's going to be that under the skin test. And then if that's positive, then we go to the x-ray, right? Just to make sure nothing's there. You can test positive, and that's sort of what you were talking about. You'll test positive if you've had some vaccines or stuff like that. So good. That's our TB screenings disaster and our phases of disasters. That was our disaster chapter. How are we going to try to prevent overdosing? What kind of survey will we ask for people to figure out, to screen, are they at risk?
Is that a harm reduction
Right? Or our behavioral risk, right?
assessment?
Yep, either of those you can say. All right, geriatrics, we talked about that. I'm not gonna go into that again. I told you my little story. That was just to help you remember. We see something a little bit about Parkinson's. Remember Parkinson's, we're gonna have some concerns with their elimination, their mobility, their safety, right? And then here again, we see hygiene, diabetic foot care, safety and leadership. We talked about professional issues, our ethics, right? Some basic skills and safety. Our flu vaccine is going to be a priority for anyone who's compromised. Fall prevention is an important one. What are we going to do for fall prevention?
Remove all of those trip hazards and assess like their main living area for those types of things.
Good. And when we're assessing that home, what else are we looking at? Not necessarily mobility, but safety.
Mm-hmm.
What other
Little
things will we look
pets.
at?
Are there
Pets.
stairs?
Good. Pets, stairs. Yep. What else?
Lights in dark hallways or bathrooms?
Yeah. Don't forget their utilities. Does their air conditioning work? Does their heating work? Right? Respite care, as we talked about, let's see. I'm just trying to go over. So we see here something about vertical transmission with a newborn. Remember, that's our STDs, what goes over that placenta. We look at secondary prevention. We're going to do our screening for our cardiovascular systems, lipid screenings. We also have our vector-borne diseases with our infectious disease. We talked a bunch about those. So those are our bug-borne ones. Osteoporosis and our prevention. Remember, if you already have osteoporosis and you're treating it, that's going to be our tertiary prevention. We take a look at pediatrics. We talked about this a little bit with playgrounds. Are they in a safe house? What else are we looking for with our kids in the house? I'll give you a clue, 1978.
Lead paint.
Very good, lead paint. So we're going to check that. Let's see. Obesity, we know we're going to be assessing. If a student is fainting at school, what's the school nurse going to do?
Take their blood sugar? Ask them if
Unfortunately,
they-
unless you have an order, you can't take their blood sugar. I know it's
like,
silly, but.
Ask them if they've been eating.
Mhm.
Like, are
What
they
else?
dizzy?
Yeah.
They had any water?
Mhm. How about their sleep? A lot of times you'll see young kids, they say, oh, I feel like I'm going to faint because they haven't eaten since lunchtime yesterday because they don't have any food in the house, right? So we want to look like broad spectrum here. What do we see with fainting? Not that fainting can't be something major, but for the most part, we're going to assess all those different areas you talked about. Research and theory. We talked about the different types of studies, right? And which is our best one. And we want to see a trend. So we want to see something repeat in studies. School nursing we talked about. Disaster planning. You guys know about your disaster kits and all that good stuff. Leadership, we're going to try to get our immunization rates up. What's some tertiary prevention we see with diabetes? What can we do for our diabetics? At the tertiary level.
Make sure they have
Go ahead, one at a time, but I know it's hard because I don't call on anybody.
Blood glucose monitor T-shirt.
Yeah, that's good. What else? What else do we have to teach them? Or treat them with? What are we going to make sure they're doing properly?
check their feet.
Check their feet was one. What else?
Insulin.
Yeah, make sure they know what they're doing. Make sure they can see the syringe. Make sure it's not expired, the medication, right? All this stuff we're going to do is tertiary. So we're going to have them show us. Remember that teach back method, right? We're gonna say, let me see you do this. How do you do this? Are they doing it clean? Are they wiping with alcohol? Those kind of things, right? Very good. Disaster, oh, we did that already. Financial concerns, we talked about insurance. We know that in our rural communities, we have some financial concerns. We have transportation concerns. We have all that kind of stuff. Secondary prevention for tobacco. What kind of screenings can we do for tobacco?
Long X-rays.
Yeah, you can do lung x-rays. What else?
Secondhand exposure.
Yeah. Secondhand exposure, we're gonna screen who lives in the home with them, right? And secondary prevention, we're going to also do that risk survey. Are they at risk to smoke? Let's see, what else? Community education, we're always gonna evaluate. That's our ADPI. Viral conjunctivitis. What's conjunctivitis?
Pink eye.
Yep, pink eye. So if it's bacterial, we can treat it with bacterial drops. If it's viral, that doesn't mean it's not contagious. It just means it's harder to treat, right? We see a little thing here about anthrax. I'm not really worried about that. And we talked a bit about fluid and electrolytes and our exercise, hydration. So if you'll see, we are seeing a trend here. Some things are repeating itself. Here we see lead poisoning again, which we talked about. Here we see abuse, suspected abuse in the home. Remember, we're all reporters, right? So if we suspect, we report. Is that right? Yes. All right, that is the end of my topics. And so at this point, I'm going to do a free question period. Ask whatever you guys want. Your HESI study, guys, like I said, is very long. Every topic that could be covered on the HESI is on there, but we don't write the HESIs, right? So we just can help guide you guys on studies. Right? There's some HESI, if you Google HESI community, you might get some practice questions. You guys have an NCLEX book. Anybody remember that NCLEX book, that turquoise book? You guys know what I'm talking about? Yes, no, maybe so. It's usually turquoise. You guys have the NCLEX turquoise book. That's a great one. There should be a little section on community in there. So do that before your HESI. That'll
Are
give
they
you practice questions.
Doing a HESI review videos, is that happening?
Yeah, all the professors will post theirs. Although I don't know how we're gonna post this one because you guys were taking a quiz for half of that, but oh well. I'll try to cut the video, I guess. All right, well, I guess nothing? No questions?
Yeah, so what about next week for class? What will we be doing?
Okay, so next week your attendance is your HESI, so you're not coming to class. Week 12, I said this at the beginning, but I will repeat it. Please, everyone, make sure you send me an email. Week 12, you have to meet with me and we have to discuss community nursing, meaning we can go over your grades or just say hi or whatever you feel like. So that's your attendance. It shouldn't take more than a little time. I'm not going to give minutes because don't hold me to it, but it's not a long period of time. So what you're going to do is either I can meet with you during our class time and then we'll set up time throughout the class, like 5:05, 5:15. Well, you know what I mean. Set 4, 6, whatever your time is, right? We'll set up times like that if you guys want. If you want to meet me at a time other than class, that's totally fine. I can meet with you. It's going to be, like I said, a really short time, but that's going to be your attendance for week 12. Okay.
So if
So
we meet you at another time, we don't have to like attend class at.
Right.
Okay.
As long as you meet me sometime during week 12, then we're good for attendance. Okay. I don't mind meeting during class, but I'm not holding you guys to having to be here for class on that week. So you make the call. I want to wish you the best of luck. We've had a wonderful class. Every one of you has added something to it, and for that, I appreciate it. I want to say that I'm looking forward to seeing you guys in the profession. You guys are almost there. Leadership and what else? That's it? No. What do we have after this? Leadership and
Mental health.
mental health. Mental health is interesting. That clinical time will be interesting because sometimes mental health, the nurses, it's different type of nursing care than what you see in some other facilities. So, but you learn a lot about people.
In fact, we give you more examples in the brief.
Okay.
I have a question.
Any questions?
I have a
No.
question.
Yes, go for it.
When is the HESI remediation due?
That is due the Sunday of week 12. Sunday of week
Okay.
12. Hold on, let me double check the date. I'm gonna look real quick. Hold on. I think it's no, and remember, it depends on your score, depends on your time. So even if you got a 99.99, you still have to do remediation for an hour. Let's see. Remediation has to be done. Yeah, it has to be done the Sunday of week 12.
Wait,
Okay,
so
I'll send out a like a numbers thing so you know how many hours you guys need. But remember, regardless if you get 100, well, 99.99, which is what the highest you can usually get, you still have to do some remediation in order to get credit. Remediation has to be done, or you get a 0 for the HESI. That's not my rule, that's Fortis's rule, right? But we know this from other classes, don't we?
So you're saying the remediation has to be done by September 30th?
Let me
I'm
look
sorry,
at the
September
calendar.
29th? Or the Sunday
Well,
before?
I'll tell you what, grades are posted by the 25th. So you gotta have it to me the week before the 25th. Let's see, let me look on the calendar. Yeah, so you have to have, you're taking your HESI next week and I need remediation done by that 22nd. Because books are closed as of the 25th.
Okay, thank you.
If I'm wrong, which I don't think I am, but I'm wrong half the time. So if I'm wrong, I'll send you guys I'm gonna send you an email with remediation date and remediation numbers, okay? Remember, that's like, so many hours on whatever. Okay, you can also do the case studies they assign. That's another way to do it. Okay, all right. Well, on that note, I'm going to end tonight at not early. I'm ending and you guys are going to study for HESI. I know that. So, right. We're all studying for HESI this evening. So, I will give you some time to do that this evening. Like I said, I really appreciate this class. You guys have been wonderful. I'm always available by email. If you guys ever need anything, I'm happy to help. And if you don't need anything else from me, I'm going to say good luck, best wishes, everything to you. You guys are almost done. And I am available if you need me. So take care, best of luck, and I will see you guys week 12.
thank you.
Thank you.
You're welcome. Take care.
Thanks.